I'm John Middleton. I'm the president of the Global Network for Academic Public Health. We need to see a united, uh, effective, strong public health community. We need to be arguing and advocating for better health for all, for improving and protecting the health of the people we serve in all our communities across the world. And we can't do that on our own. We have to be working across borders because the diseases and the illness that we face isn't confined to national boundaries. What I see as the significant change really since 2023 in Rome is an acceleration of intolerance, an acceleration of nationalist ideals, an acceleration of the epidemic of hatred, and an acceleration of disinformation and distortion and disdain for public health and disdain for scientific knowledge and fact. And this is something that we all have to challenge greatly in our discussions in Cape Town. I think people increasingly in the public health world understand that health is not an issue that stays confined to national borders. And we know that particularly with the pandemic experience, we know that we can't limit the spread of infectious disease within individual countries. But it applies also to the control of commercial determinants. We can't limit our efforts in single countries to reducing smoking or reducing harmful diets. Or for the pernicious effects of global gambling or organized crime. So we need to be active across borders. We need to be active as a global organization, and I think there is increasing awareness in the public health community of the need for us to work together. We need to look south and we need to look east for the best examples of public health, and indeed for the political leadership and the world is changing. We no longer can rely on tired neo-colonial mentalities. And we need to see strong leadership as we see in South Africa. And I'm very excited to be with colleagues in South Africa who I've worked with on things like the WHO roadmap for public health workforce. And we need to be enthused and excited by what South Africa and indeed the African continent has to offer to us in terms of public health leadership. If I was given the microphone for the final plenary, I would say we have to be united. We have to show solidarity. We have to remain committed to principles, our ethics, our values for protection and improvement of the health of the public. And we have to see ourselves as servants of the people and servants of the planet. And at a time when the world is geared to breaking up its partnerships, breaking up the global solidarity that we may have seen since 1945, we need to see a rebirth of the collective understanding of protecting the health of people and planet. There's no more important time to be working in public health, and perhaps no more difficult time. But we have to go away from Cape Town committed to making those improvements to people and planet's health. Thank you.